What if your health insurance premium suddenly jumped by $11,000 a year? For millions of middle-class Americans, this nightmare could become reality if Congress doesn't act fast. Will a rare bipartisan effort save affordable health care before time runs out? Millions of Americans are anxiously watching Congress this month, as subsidies that make health insurance affordable for many, including middle-income families who often fall through the cracks, are set to expire at the end of the year. The Bipartisan Premium Tax Credit Extension Act is here to change that. But can it move fast enough to stop a looming financial crunch for these families? These enhanced premium tax credits have given families earning above 400% of the federal poverty line a much-needed break. We're talking about households making just over $62,600 for an individual or $128,600 for a family of four. Without these subsidies, premiums for many middle-income families could shoot up by over $11,000 a year. That's around 75% more to keep the same insurance plan. What happens if Congress doesn't act? More families may drop out of the Affordable Care Act marketplaces altogether. Healthy people leaving means higher premiums for those left behind. The Bipartisan Premium Tax Credit Extension Act, introduced by Jen Kiggans and Jared Golden, is a rare example of lawmakers breaking out of their partisan boxes to address this urgent issue. Golden put the stakes bluntly. Letting the ACA enhanced premium tax credits expire would raise costs on Maine families. That's simply not an option. With around 61,000 Mainers relying on ACA marketplace plans, the urgency is clear. On the other side of the aisle, Kiggans emphasizes the bill's practical benefits. This isn't about red versus blue. It's about keeping health care within reach for families who work hard and play by the rules. The clock is ticking. Insurers had to set their 2026 rates months ago, assuming those subsidies would disappear. The result? Higher premiums already baked into next year's plans. If Congress acts fast, insurers might be able to lower premiums during open enrollment starting November 1st. The longer this drags out, the slimmer the chance of adjusting those rates. Consumer advocates are sounding the alarm. We have days, maybe weeks to get this done, says Adam Fox of the Colorado Consumer Health Initiative. Otherwise, it's going to hit families hard. This bipartisan cooperation is refreshing, showing lawmakers can still come together for common-sense solutions. But will they move fast enough to help middle-class families who can't afford to wait? Key takeaway number 1. Without congressional action, millions of middle-class families could see their health insurance premiums increase by up to $11,000 per year when current subsidies expire at the end of the year. Key takeaway number 2. The Bipartisan Premium Tax Credit Extension Act, introduced by Representatives Kiggans and Golden, aims to extend these crucial subsidies for families earning above 400% of the federal poverty line. Key takeaway number 3. Time is critical. Insurers have already set 2026 rates assuming subsidies will expire. If Congress acts quickly, premiums might still be adjusted during open enrollment starting November 1st. Thank you for watching our coverage of this important healthcare issue. As Congress races against time, millions of American families are counting on bipartisan cooperation to keep their health insurance affordable. Stay informed as this critical legislation develops.